You know, folks, the only thing worse than doing something dumb is doing something even dumber to try to make up for it. Now, if William Shakespeare didn't write that, he should have. Let me give you, for instance, there's a hospital in Rhode Island. They're seeing a new outbreak of COVID infections after it started allowing asymptomatic COVID-positive healthcare workers to keep working. Now, I'm going to pause for a moment to allow that to sink in, but my guess is that you're like me and none of this crap surprises you at this point. You're also probably one step ahead of me in the story in that in your mind immediately went to, wasn't they firing people 5 minutes ago for not taking the blah, blah, getting the juice and the boost? Yes, indeed, a decision which led to the sort of conditions in hospitals around the country where they were, you guessed it, short-staffed. My, how the chickens come home to roost, baby. Of all the occupations in the world that should be sending even mildly sick people home from work, hospitals rank pretty nearly at the top of the list, and yet here we are. Now, the hospital in question, they've denied that there's any connection between this policy and the sudden uptick in cases because, of course they have. Of course they have. That's what they do. So let me go down a slight rabbit hole here for just a second. Can you even begin to imagine how many medical lawsuits are coming down the pike over the next decade or so? We all know that every time a hospital or doctor makes a stupid decision, a lawyer gets his wings, right? Just imagine the almost certainly billions of dollars things like this happening all over the country is going to cost in the long run. Now, I'm not an overly litigious person, but I have to admit the thought kind of amuses me sometimes. Anyway, back to this shining example of pure unvarnished stupidity. The hospital claims that its COVID-positive staff were, with one exception, only working with COVID-positive patients. So it couldn't possibly be the case of the new cases emerging among the other patients in the hospitals that are related. Now, this may come as a shock to you. I'm not a doctor. I don't even play one on TV, but I will give you my opinion. Nevertheless, even I am aware of the strikingly larger transmissibility rate of the Omicron variant over its virulent forebears, which means I'm capable by the powers of deductive reasoning of coming to the conclusion that it damn well might be possible for this thing to spread throughout a hospital like wildfire. But that's what it does. Because here's the thing, we're all human. And if you've paid attention at all over the past couple of years to all the hand-wringing hysteria, you know that even in the middle of it, people don't always follow protocol down to the letter. And even if they did, most of the protocols surrounding COVID were dreamed up in the early days of the first strain. We were so young. Remember those days? We were so naive, so young, so fresh, virginal even. Now, maybe in the long run, this is actually a good thing. Maybe it's the case that we all need to get Omicron and just get it over with. Maybe that even applies to people in the hospital for other reasons, although I wouldn't think that that's the best place and time to do it. But if we're all going to end up getting it in the end anyway, maybe now's the time. So here's a news flash. That doesn't change the fact that these people are idiots for having previously fired their staff members for not getting the juice, which likely wouldn't have stopped them from getting Omicron anyway. It doesn't excuse the jackasses on high that mandated it in the first place. Stupidity abounds in this crazy world, folks. But what do I know? Like I said, I'm no doctor. But that's the deal. Rhode Island, like this set is bigger than Rhode Island. And everybody's getting the Omicron. They're letting them go to work. But you know, again, people say, well, what difference does it make about Rhode Island? Well, here's the deal. They're doing it everywhere. This is just one of the cases that we're talking about. Yep. These hospitals are letting COVID-positive, asymptomatic, vaccinated people come back to work. But people who have never had COVID or don't have COVID or test negative but have never been vaccinated can't go to work as a medical professional.